Chronic kidney disease, or also known as end-stage renal disease or stage 5 of chronic kidney disease, is the presence of kidney damage for over 3 months. Kidneys are unable to excrete metabolic waste, regulate fluid, and electrolyte balance. Our patient is a 64-year-old female diabetic with a history of chronic high blood sugar, so now her kidneys are failing.
I will ask you some questions about chronic kidney disease.
Okay.
Do you know what causes chronic kidney disease?
Yes. Some causes of chronic kidney disease are diabetes, hypertension, glomerulonephritis, polycystic kidney disease, and lupus. And you're at risk if you are 65 years old or older, and you're African American, and or if you are male.
The specific cause for a patient is diabetic nephropathy. This is when the increase of glomerular filtration rate leads to hyperfiltration. This eventually causes glomerular damage and thickening and scarring of the glomerular basement membrane and glomerulus. The gradual destruction of nephrons leads to a decrease in the GFR, which eventually leads to kidney failure. The signs and symptoms of kidney failure include uremia, fluid overload, hyperkalemia, hypertension, both peripheral and pulmonary edema, ataxia, unsteady gait, asterixis, clapping hands, pallor due to anemia, yellow-green skin color, pruritus, Kussmaul's respirations, nausea, uremic fever, anemia, reproductive changes, osteodystrophy, brittle bones, bone pain, and muscle cramps. So there are 3 therapies that we could do for you. There's going to be a kidney transplant, which replaces your kidney with a relative or a non-relative or a deceased person. There's also a peritoneal dialysis, which is dialysis fluid that's inserted into your abdomen, and that fluid basically cleans out your system, and then you yourself will remove the fluid maybe 4 to 5 times every day and replace with new fluid that will also take out the toxins in your blood, which is taking place of your kidneys. And there's also hemodialysis, which I believe is the best option for you. Basically, it's an artificial process of eliminating waste and unwanted water from your blood. Since this is the function of your kidneys and your kidneys aren't working properly, dialysis would be the artificial replacement. For hemodialysis, you could receive an AV fistula, which is created by attaching an artery and a vein. The blood is pumped out of the artery, filtered through the dialyzer, and returned through the vein.
I think I'll choose hemodialysis.
So it's important to educate the patient about what meds to avoid, such as meperidine, metformin, NSAIDs, and some oral hypoglycemic agents. And for a patient with chronic kidney disease, you should take antihypertensives to fight against the renin-angiotensin system when the kidneys fail, diuretics to help with fluid retention that may occur, and ACE inhibitors, and erythropoietin replacement to stimulate red blood cell production by the bone marrow. And then a diet for a patient with chronic kidney disease would be to increase protein intake, avoid salty foods, and limit potassium and fluid intake.